This is a CJSON podcast, and I'm Thomas Mavrakanas from the Brigham and Women's Hospital. In patients on maintenance hemodialysis, atrial fibrillation is a common condition. However, it is unclear whether these patients should be anticoagulated for stroke prevention. Previous observational studies failed to show any benefit from warfarin administration compared with no treatment for stroke prevention in this population. In a more recent study, Apixaban, a direct oral anticoagulant, was found to be safer than warfarin in patients on maintenance hemodialysis. In this study, we were interested in assessing the relative efficacy and safety of Apixaban compared with no anticoagulation in patients on maintenance dialysis with incident atrial fibrillation. To study this, we used the United States Renal Data System to identify all patients on maintenance hemodialysis with a new diagnosis of non-valvular atrial fibrillation and available administrative data who received Apixaban or who did not receive any anticoagulant agent. Then, we matched 521 patients who received Apixaban with 1,561 patients who were not treated by any anticoagulant agent using a propensity score. We found that Apixaban was not associated with a lower incidence of any stroke, transient ischemic attack, or systemic thromboembolism, but was associated with a higher incidence of a composite endpoint of fatal or intracranial bleeding compared with no anticoagulation. In addition, we observed a trend towards fewer ischemic but more hemorrhagic strokes in patients treated with Apixaban compared with no treatment. In addition, we separately studied outcomes with both the standard Apixaban dose of 5 mg twice daily and the reduced dose of 2.5 mg twice daily. We found that Apixaban at the standard dose of 5 mg was associated with a higher incidence of stroke or embolism, a higher incidence of hemorrhagic stroke, and a higher incidence of fatal or intracranial bleeding compared with no anticoagulation. On the contrary, a higher incidence of ischemic events was observed in patients treated with a reduced dose of 2.5 mg of Apixaban twice daily. Our results suggest that a randomized trial comparing Apixaban with no anticoagulation is needed in this population. Awaiting randomized data, prescription of Apixaban for stroke prevention in patients on maintenance dialysis, especially at the standard dose, is not an evidence-based practice. I want to close this podcast by thanking all the co-authors involved with the study and the United States Renal Data System that provided the data reported here.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.